Dr. Amanda with StraightSmile Solutions, and today we're going to be talking about Invisalign first and Invisalign second, and a little bit more about phase 1 treatment and the options that are out there. And if you haven't already registered, don't forget to jump on my webinar, which is going to be November 5th, 2019 at noon Central. You can go to my website at StraightSmileSolutions.com and click on the Webinars and Seminars tab, and you can go ahead and register. It's free. And I'm co-sponsoring it with Ohlendorf Orthodontic Lab. And we're going to be talking about phase 1 and aligners in phase 1 and what the options are. Anyways, okay, so I've kind of waited a little bit to talk a little bit more about Invisalign first because it's been around for about a year and a half. I just kind of wanted to see how it played out. Seen a few cases, a lot of things I like about it, a lot of things I don't like about it, a lot of other options that are out there, and there's a lot of confusion. It's really confusing. It really is. So I kind of want to dumb it down for you and just talk about it at a very high level so you can understand it a little bit more. And this is, of course, a doctor-facing, lecture today. But you can kind of see the animation here. What are we doing? This is permanent teeth here, right? Baby teeth back here. We're talking about phase 1. Phase 1 is fixing the bite in a growing child, okay? And then sometimes also straightening the front teeth, sometimes not. For me, phase 1 is defined as fixing the bite. So you should be fixing overjet, overbite, cross bites, transverse issues, vertical issues, right? AP issues. So we're talking about all different directions. So fixing the major problems, setting up the jaws in a successful way so that the teeth will hopefully come down in a healthy way. If you create the space, the teeth will come in right, theoretically. Not always happening. Sometimes there's impactions, things can happen. But in theory, this should happen. And that's what Invisalign first is about. That's what phase 1 is about. Okay, so let's watch this animation again. Child with underdeveloped jaws. This can happen. Sometimes it's genetic, sometimes it's soft food, sometimes it's diet, sometimes it's oral habits, thumb sucking, bottle sucking, pacifier. So many different things can cause this, And so we are just setting the child up for success by expanding the arches and maybe doing some limited straightening on the front teeth, okay? So that's what that's about. Invisalign first is not the only option out there. Phase 1 has been around for hundreds of years. We've been doing it for a very long time. It comes in and out of style, like anything else. So right now, I think it's very much in style. I think people are concerned that it's expensive, and Invisalign first is pretty expensive. So, but it's not the only way to do phase 1. So don't forget, again, to sign up for our webinar. But anyway, so price point for Invisalign first. And remember, this is not total Invisalign. This is up to 18 months of limited treatment in a small kid. And there's all kind of rules in terms of how you can be included in this population. So you can't just have an 8-year-old and say they're going to do Invisalign first. So don't promise this to your patient because you have to qualify for it. And there's a lot of rules and it's very confusing. Okay. So, but the rules make sense to me. I get it. So price point, at least in the United States, is $1,179. It is all inclusive. So if they need a revision, refinement, this is all included. Up to 18 months, your treatment will expire after 18 months from the date it is shipped. Okay. So you cannot dilly-dally. Can't have a non-compliant patient. Compliance is, of course, huge. So you need to partner with the right parent and the right kid, get it done, and get them out. Okay, so let's go over some of the things. Criteria. This is the most important part, I think, okay? So basically what they're saying is that you need to have your permanent molars in, 6-year-old molars in, and at least 2 front teeth, 2/3 erupted, and you need to have at least 2 primary, teeth in each quadrant. I'm confused too. 2 primary or unerupted permanent teeth per quadrant in at least 3 quadrants. So you can't be missing all kinds of teeth, basically it comes down to, okay? So you need to have, you're in mixed condition, they can't all be missing, you need to have a fair amount of teeth in, okay? So this is not good for someone you did a bunch of extractions on. So otherwise they'll reject you, okay? So they said this is driven by the dental age and not the physical age. So it's not about being 8, 9, 7. It's about what teeth are in. For me, and they're going to let you do some what we call eruption guidance. So if there's a tooth that obviously kids that are in mixed dentition, they're losing teeth like crazy, right? Teeth are coming in, teeth are getting lost. And if you're doing aligners, how's that possible, right? You're going to constantly be rescanning. So if you're going to do Invisalign first, you have to have a scanner. I'm just going to say, you have to have a scanner. You cannot be doing impressions. The parent is going to hate you. The kid's going to hate you because you're going to be doing a lot of revisions and refinements. It's just going to come with it because teeth are going to come in and out, and they can kind of do the eruption compensation Ponticky things and kind of guess, but they're not really going to know. So you're going to go maybe a month or two, and guess what? You're going to rescan and do it again. Okay. And it's not going to cost you anymore. It's just going to be, there's going to be a lot of chair time for this case. And to me, I'm just saying, wow, this sounds like a big pain in my, you know what, to do this. It really does. Now, that being said, there is a sweet spot. I call it the sweet spot with phase one with kids when you'll have about a year of latency. And that means there's especially if you pull the baby canines out, okay, which I normally don't always do unless there's some impactions. But in terms of phase one aligner treatment, I do. Because if you can pull the baby canines out right after the front 4 incisors, top and bottom, come in, pull those baby canines out, okay, and you'll probably have a good 8 to 14 months before you lose any other teeth, okay? Maybe even 18 months. That's when you want to do it. There's a perfect timing, and if you don't get the timing right, sorry, do something else, because that way you won't have to rescan. That's my suggestion, okay? Okay. So conditions, basically what they're going to do is they're just going to expand the arches with aligners. It works fine. I mean, it's good. And you can get up to 4 to 6 millimeters of expansion. Hey, I can get a heck of a lot more with an expander, which is, by the way, way cheaper. It's not $1,179. It's like $150, but whatever. If you like plastic, well, I mean, it's still plastic, so either way, whatever. Also, they have that MA feature. It's called mandibular advancement. People think this is super fancy. It's really not, because I can get this at any local orthodontic lab built into my twin block, which, by the way, is way cheaper. Again, I'm just guessing around $200. Way cheaper. And I could also build the expansion into an appliance like that and have it all in one appliance and have it be around 200-ish bucks. Maybe a little bit more for upper and lower, and not 1179, but okay. So, and they do say that it's not designed for people that have class 3, need palatal expansion, not just arch expansion, like have a skeletal issue or have habits. Now, I don't doubt, judging by some of the patents I've seen Invisalign come out with, and I do follow their patents, that some of this stuff will be coming out very soon. Matter of fact, I think some of it's coming out next year. Brilliant. But again, you can buy all this stuff at your regular ortho lab, probably easy and way cheaper. Okay. So, Invisalign First is only for kids and mixed dentition, can't be used for adults. Okay, that makes sense. Remember, this is, again, 18 months only in young kids in a certain stage of mixed dentition, probably for 7, 8, 9-year-olds, but it depends on the dental age. Later, you get to do Invisalign Second, and they don't quite say the price for that. They say it's going to be discounted off the comprehensive price, which in the US is $1,879. I don't know how much discount's going to be, probably not too much. So you got to figure your lab fee is around $2,500. Am I doing this right? $2,500 to $3,000 maybe? I'm just guessing. Something like that. Total lab fee. So you need to make sure you're charging accordingly because it's going to get expensive. But, okay. So anyways, really not that exciting, just that they can kind of gauge and work around teeth that are coming up. Okay, let's take a step back. You can do aligners. I've been doing for phase 1 aligners for quite some time. Not that special, okay? You can do this white label. You can do it with ClearCorrect. It's all under the table. Like, they don't market that they do it, but you can do it, okay? And I'd be more than glad to tell you about it. Way cheaper, way easier, I think, honestly, because here's the benefits of doing some of these other designs. Is the problem with Invisalign is because their trim is scalloped and the material is so flexible that you have to put a heck load of attachments on the teeth in order for it to retain. Guess what? If you use a more firm material, and maybe you're not doing 4-day changes, but in a higher trim line, you don't need attachments for the most part on the teeth, unless they're crazy, crazy crooked. So that's pretty cool, because I would not want to be doing attachments on a 7-year-old. I think I'd pass on that. That's a lot of work. So not only are we doing attachments, taking them off probably each time you're doing a revision refinement, but you're also scanning multiple times. Count up your value of your chair time, and this is getting a little ridiculous to me, but whatever. So, yes, so you can do this. Price point for Clear Correct is $95 for the setup, $35 per tray. That's upper and lower. So that's $70 for like number one, you know, and $70 for number two. So assuming your first treatment is usually around 10 to 15 aligners, I'd say on average, maybe 20. Upper and lower, you can do the math. I mean, it's going to be pretty similar to this Invisalign First price, actually. But you can do white label for cheaper. $90 to $149 setup fee and $15 per aligner. So that's a heck of a lot cheaper. That's more like $400, $300, $500. So that's pretty cool. But again, there's no eruption compensation tab. So if you misjudge the timing on this, it's out of your pocket. There's nothing you can do. Okay. So that's pretty much all I wanted to tell you about Invisalign First, Invisalign Second. I'm not saying it doesn't work. It works. I just think it's a ridiculous amount of chair time, and I don't think it's worth the price. And you can do all this stuff, all these features on your own with a local dental lab and or one of these white label aligner workflows. And you do not have to have any equipment to do white label aligners. Okay. So buzz me if you've got questions, and you can pay a third of the price. But if you want turnkey, that's what this is about. So anyways, that is pretty much it. Any questions, don't forget to go to StraightSmileSolutions.com, and we'll be glad to tell you more about aligners or phase one. And please sign up for our webinar on November 5th. Go to StraightSmileSolutions.com/media. All right. Thanks so much. Have a great day.